Hi everyone. So today we'll be talking about urinary incontinence. So what is urinary incontinence? When you are not able to hold your urine and few drops of urine leak out while you're sneezing, coughing or laughing and it's not under your control. So that is what is called as urinary incontinence. Now, what is the reason behind it? Is it normal that happens with aging and you just can't do anything about it? No, it is not. It happens because of weakness of certain muscles. It happens because of weakness of pelvic floor muscles, which are surrounding your urinary aperture, जहाँ से हम अपना यूरिन पास करते हैं, स्टूल पास करते हैं एंड हमारा जो वेजाइना का एरिया होता है, ओके, उस एरिया में कुछ मसल्स होते हैं जिन्हें हम पेल्विक फ्लोर मसल्स बोलते हैं. सो जब ये मसल्स वीक हो जाते हैं देन we are not able to control the passage of urine when we laugh, cough or sneeze. Definitely it is very common in women because of childbearing, pregnancy, delivery, okay. So whenever, or maybe because of some surgery, lower abdominal or vaginal surgery which has affected the muscle strength, whenever there is a cut in the muscle there is weakening in the muscle and it doesn't get its strength back on its own just after healing. We have to literally work on it. There are different ways how it is being treated. It can be treated with your pelvic floor strengthening exercises, or you might be needing certain form of medications or other treatment strategies might be used depending on your problem. So yes, definitely, you this is not something which cannot be worked upon. This can definitely be worked upon. You just need to visit your gynecologist and you just need to learn the appropriate form of exercises. That's all. Thank you.